Hi, today I'm going to be talking about exertional heat illnesses. The first one is exercise-associated muscle cramps. So these are sudden or they can be progressively noticeable. These are painful involuntary contractions during or after exercise. These are not heat cramps though. Heat cramps are usually related to the elevated body temp, where muscle cramps are not. The signs and symptoms are tics, stiffness, tremors, and contractures. These signs and symptoms are usually painless. Um, these muscle cramps are not completely clear of the cause, but some factors are dehydration, electrolyte imbalance, altered neuromuscular control, or fatigue. Heat syncope is the next one. So this often occurs to someone who is unfit and is standing out in the heat for a very long period of time, especially for individuals who are wearing uniforms or insulated clothing. The cause is usually dehydration, venous pooling of the blood, reduced cardiac filling, or low blood pressure. You can mainly see this in the first 5 days of unaccustomed heat exposure, so for athletics, definitely in the preseason stage. Heat exhaustion, this is the inability to effectively exercise in the heat. So it's a combination of factors like your cardiovascular insufficiency, hypotension, energy depletion, and central fatigue. Signs and symptoms, your body temp is elevated to 40.5 degrees Celsius. You have a high rate or volume of the skin blood flow, heavy sweating, dehydration. This occurs more in hot or humid conditions, but it can occur in a normal environment with intense physical activity. Most often, it affects dehydrated individuals who have a body mass greater than 27 kilograms. The next one is exertional heat injury. So this is a moderate to severe heat illness, and it's characterized by your organ and tissue injuries. It's associated with sustained high body temps. It's a result from strenuous exercise and environmental heat exposure. Your body is usually, but it's not always, greater than 40.5 degrees Celsius. So now is the exertional heat stroke. This is the most severe illness. It is characterized by a neuropsychiatric impairment and a high core body temp of greater than 40.5 degrees Celsius. It is a product of both the metabolic heat production and the environmental heat load. So it occurs when your thermoregulatory system becomes overwhelmed due to the exercise heat production or the inhibited heat loss. It can occur with intense physical activity in the absence of extreme environmental conditions. Your first sign is the central nervous system dysfunction, so you collapse, irritability, confusion, or seizure. If it's not treated, it can progress to a systematic inflammatory response and a multi-organ system failure. Prevention, so you have pre-participation medical screenings before the start of the season to identify any athletes with the risk factors. These should be done by a physician. Individuals should be acclimatized to heat gradually over 7 to 14 days. So heat acclimatization involves progressively increasing the intensity and the duration of physical activity and phasing in equipment if it is worn. Individuals who are currently sick with a viral infection or any other illnesses, fevers, or serious skin rashes should not participate until it's resolved. Even when the symptoms are gone, you want to make sure to watch that individual closely. Individuals should maintain the appropriate amount of fluids that are lost during games and practices. Players should have free access to available fluids at all times, not just during designated breaks. You need to be able to instruct them to eat and drink the appropriate sodium-containing fluids and foods to replace the sodium losses. Remind them that urine should be light. The sport medicine staff must educate the relevant personnel on how to prevent and recognize heat illnesses and heat strokes. Signs and symptoms should be reviewed, and at every institution, and every personnel should have an emergency action plan. The appropriate medical care must be available. The personnel should be familiar with these heat illnesses, the prevention, the recognition, and the treatment. Any certified athletic trainer or healthcare providers have the authority to restrict any individual that that they believe are showing signs and symptoms of a heat illness. The best way to help is a cold water or ice tub. Even ice towels should be available to immerse or soak the patient. The assessment of a rectal temp is the clinical gold standard of obtaining a core body temp. There's no other method or that is valid or reliable. So you need to educate parents, coaches, and the athletes ahead of time that this procedure will be done if they have a heat illness emergency. Athletes should be encouraged to sleep at least 7 hours per night in a cool environment, eat a balanced diet, properly hydrate before, during, and after exercise. They should also be advised to rest in a cool environment when they are not active. Rest periods should incorporate meal times, 2 to 3 hours, so their food and fluids and everything can be digested and absorbed. A preseason heat acclimatization policy should be developed for organized sports and event guidelines made for hot and humid weather conditions. So the first 2 to 3 weeks of preseason practice sessions should be shortened just to reduce the risk of the participants. Make sure that you give special attention when there are high intense drills and when full protective equipment is being worn. Rest breaks should be planned and they need to work to rest ratio. So breaks should be in the shade or a cooling zone. This is where they get time to consume fluids and they should be able to take off their equipment as well. Any supplements or substances that have dehydrating effects, they increase the metabolism or affect body temp is discouraged. These supplements may increase the risk of an heat illness. So recognition, the muscle cramps, you can see visible cramping. It's very localized pain, your dehydration, the thirst, sweating, and your fatigue. You can look through medical history to obtain, to see if any muscle cramping is more than an underlying clinical condition. So heat syncope, so fainting, dizziness, tunnel vision, pale or sweating skin, decreased pulse rate while standing in the heat. Responsive breathing and the pulse must be assessed to rule out a cardiac event which has very similar signs and symptoms. Exertional heat exhaustion, so excessive fatigue, they faint or they collapse with minor cognitive changes, so they have a headache, dizziness, confusion. So more signs are like fatigue, weakness, vomiting, nausea, lightheadedness, low blood pressure, impaired muscle coordination. Athletic trainers should be able to assess the patient's CNS function by noting any bizarre behavior, altered mental status, confusion, disorientation, or anything that may indicate something more serious, such as a heat stroke. A heat stroke, 2 main diagnoses, the CNS dysfunction and a core body temp greater than 40.5 degrees Celsius. They are dehydrated, hyperventilating, hot and wet skin, hypotension, disorientation, confusion, dizziness, loss of balance, they lose consciousness. Heat injury, so this is a moderate to severe illness. So it usually reveals a very dark Coca-Cola kind of colored urine and severe muscle pain and abnormal blood chemistry levels. So treatments for muscle cramps, you want to rest, make sure that they static stretch. They could ice and massage, tell them to drink plenty of fluids. They're usually conscious when this is happening, so you can give them fluids to them orally. So then heat syncope, you want to move the patients into a shaded area and monitor their vital signs, elevate their legs above the level of the heart, and start cooling and rehydrating them. Exertional heat exhaustion, you want to move to a cool, shaded area, remove any equipment or clothing. You want to begin body cooling them with fans or ice towels, and monitor their vital signs, and you should be putting them in a supine position with the legs elevated above the heart, and then begin to do their fluid replacements. If it gets worse, then you need to call an EMS. Exertional heat stroke, so it's a lower body temp of less than 38.9 degrees Celsius within 30 minutes. That's what you want. So you want to put them in a tub of cold water, and as they're in the tub, remove their clothing, the excess clothing, so you don't waste time. So up to the neck, the water should be 1.7 degrees Celsius. You remove the patient when they're 38.9, because you do not want to overcool them. And then you want to cool the patient first, and then they can transport. In the emergency action plan, there will be policies and procedures for cooling the patients before the EMS responders get there. To return to activity, the athletic trainers, they must monitor the patient's conditions until all signs and symptoms are not there. With a patient who has a heat stroke, they are cooled, effectively sent home, so they may be able to resume modified activity within at least 1 month, as long as a physician is clearing them. After the patient has completed 7 to 21 days rest period, the normal blood work results, and obtain physician's clearance, they may then progress to physical activity, but this needs to be supervised by the ATC. You do low intensity to high intensity. So thermoregulation, it is a complex interaction of your central nervous system, the cardiovascular system, and the skin to obtain your body temp. Core body temp is all determined by the metabolic heat production and the transfer of body heat to and from the surrounding environments. Hyperthermia and EHS, signs and symptoms, same thing: dizziness, confusion, behavioral change, coordination difficulties, decrease of cognitive functions, reduce of physical performance, and collapse. It affects your body temp, and it depends on the duration, not necessarily the degree. If not quickly recognized, it can cause long-term neurological deficits. So environmental, hot and humid environment conditions have a high risk for heat strokes. When the humidity is high, the evaporation heat loss is severely diminished, which this can lead to a rapid core body temp. Caution is very necessary when you're setting protocols based solely on the climate due to the differences among the different regions of the country. Athletic equipment and rubber to plastic suits used for weight loss do not allow your water vapor to pass. Wearing helmets is also a risk for heat illness. Excessive clothing, you want to have as little clothing when it's very hot out as you possibly can. It does decrease your body's ability to thermoregulate. Non-environment, heat acclimatization, if you don't go through it for those 10 to 14 days, you are at a higher risk. The exercise intensity, the poor physical condition, increased body mass index, dehydration, any illnesses, history of exertional heat illnesses, medication, drugs, electrolyte imbalance, hospitalization, and recovery. And all of this was found at the NATA Exertional Heat Illness Position Statement.